Good morning, everyone. It's 11 o'clock, so we'll go ahead and get started. I want to thank everyone for joining us today. This is the Rock County Public Health Department media briefing. These take place every Thursday at 11 o'clock, and we do stream these live on our Rock County Public Health Department Facebook page. Afterwards, the recordings will be available on our Facebook page and on our YouTube channel. So with these briefings, we get started with some remarks from the Rock County Public Health Department, and then we open it up to questions from our participating media partners. My name is Jessica Turner. I'm the Communications Specialist for the Rock County Public Health Department. And today we also have Katrina Harwood, Health Officer, Nick Zupan, Epidemiologist, Kelsey Cordova, Public Health Supervisor, and Seth Longcar, Administrative Services Supervisor. So I will start by turning it over to Nick Zupan for some data updates and information.
Thanks, Jessica. So in terms of our COVID case activity, we are still seeing a steady increase in the number of new cases that are reported to the health department. Over the course of the pandemic, we've had 15,171 Rock County residents test positive for the disease. And since last week, this is an increase of about 220 additional cases. So we continue to see these weekly increases kind of step up and up. As we're moving along here for the past few weeks, we're averaging about 33 new cases per day over the last week, and this also represents a pretty steady increase in COVID activity. We're estimating right now that there are about 314 active cases in the community, and there have been 167 deaths due to COVID-19 over the course of the pandemic. There have been 2 additional reported deaths since last week. And most recently, our data on hospitalized cases, we have had 17 patients in the hospital getting care for COVID-19 this week, which is quite a bit up from where we were last week. In terms of our vaccination efforts, we now have over 54,000 Rock County residents who've gotten at least the first dose of the vaccine. So this is about 1/3 of the Rock County population. And about 37,000 Rock County residents have gotten the full vaccination coverage. So this is about 23% of the total population. And in terms of our 65 and older group, we're nearly to 80% of our 65 and older population having at least 1 dose of the vaccine, and about 69% of that group getting full coverage from the vaccine. So we're seeing ongoing continued increases in our vaccination efforts. I did want to cover today the increases that we're seeing in our case activity and our hospitalized cases particularly. Over the last week, we've seen our hospitalized cases due to COVID-19 double since last Monday. So most recently, as I said, we've had 17 patients in the hospital getting care for COVID-19. The last time we saw the hospitalized numbers this high was February 10th, as we were kind of coming down from our fall and winter surge of COVID activity. In terms of the demographics of those who've been hospitalized, we're seeing a larger number of hospitalized cases between the ages of 50 and 65, and these individuals have not yet been vaccinated based on the records that we have. Normally what we do see is an increase in hospitalized cases around 3 to 4 weeks after we see our case activity increase. And so earlier in the pandemic, we saw this kind of relationship, and again, we're seeing this with our COVID activity increasing about 3 to 4 weeks ago. We're now seeing our hospitalized cases increase as well. In terms of our active cases as well, we are seeing over the past month the number of active cases in the community double. On March 19th, we were down to 126 active cases. And as of April 14th, there are 314 active cases in the community based on our information and our records. So this again just represents that there seems to be some increasing COVID activity, and we're seeing an increase now in our hospitalized cases. And one of the explanations that we're looking into is the B117 variant strain of the virus. It has been identified in Rock County, and we are now probably seeing the results of the spread of this variant strain, and that's leading to some of the increase that we're seeing. We're also hearing about people who are traveling and maybe taking less precautions with social distancing and mask wearing, and those can also contribute to increases in the spread of the virus. So combined with the circulation of this new variant that is more contagious and could potentially lead to more severe illness, I think those are probably the reasonable causes for some of the increase that we're seeing most recently. So with all of that in mind, it's still very important to practice the prevention measures that we've been kind of indicating throughout the pandemic, but mask wearing and social distancing are very, very important. Even as we're rolling out the vaccine, it's still very important to practice these prevention measures as this new variant is circulating in our community. Those are going to be the best ways that we can prevent the spread of the illness, in addition to hand washing. And as you're eligible and able, please get the vaccine, and using those kind of 4 methods will be our best chance of fighting the virus. So with that, I'm going to turn it back over to you, Jessica.
Thank you, Nick. I'll turn it over now to Katrina for some additional information.
Thank you, Jessica. I wanted to provide a little bit of information regarding the Johnson & Johnson vaccine. Out of an abundance of caution, the Wisconsin Department of Health and Human Services is pausing the Johnson & Johnson vaccine distribution. The use of the Johnson & Johnson vaccine being paused is to allow time for CDC and FDA to explore the situation further. And the state's guidance to pause the use of the vaccine is in accordance with CDC and FDA. Based on reports to the Vaccine Adverse Events Reporting System, 6 cases of a type of blood clot called cerebral venous sinus thrombosis was seen in combination with low levels of blood platelets. The Vaccine Adverse Events Reporting System is a national surveillance system jointly managed by CDC and FDA that monitors adverse events after vaccinations. Reports of these adverse events are taken very seriously. The blood clotting events that have been reported through after taking the Johnson & Johnson vaccine are very rare. To date, CDC has identified 6 cases out of nearly 7 million doses of the Johnson & Johnson vaccine given. This is about one person experiencing these adverse reactions per 1 million vaccines. For comparison, 1 in 10 Americans have been infected with COVID-19, and 1 in 591 Americans have died from COVID-19. Treatment for the specific blood clot is different from the treatment options for different types of blood clots, and this pause will allow CDC and FDA to assess the situation. The Advisory Committee on Immunization Practices met yesterday, April 14th, to conduct a further review. And right now, the intent is still to pause distribution of the Johnson & Johnson vaccine. We will wait for more information from our state and federal partners, and we'll be providing that information out to the community as well. At this time, vaccine providers should not be administering Johnson & Johnson vaccine, but they should still maintain the Johnson & Johnson vaccine in storage with proper vaccine handling. Getting the COVID-19 vaccine is very critical in this part of our response. We continue to urge Wisconsinites to get vaccinated as soon as you are able to and have the vaccine available. The adverse events associated with the Johnson & Johnson vaccine have not been associated with the 2 other vaccines that are available, Pfizer and Moderna. Right now in Wisconsin, we do have both the Pfizer and Moderna vaccines available in good supply, and 96% of the doses of vaccine given in Wisconsin have been Pfizer or Moderna. For people who have received the Johnson & Johnson vaccine, I want to emphasize again that the adverse reactions that have been reported are extremely rare, and we are asking that those vaccines no longer be provided during this time of evaluation. Individuals who receive the Johnson & Johnson vaccine should contact their healthcare provider if they are experiencing adverse reactions such as severe headache, back pain, abdominal pain, leg pain, or shortness of breath within 3 weeks after vaccination. These symptoms have generally occurred between 6 and 13 days after vaccination. People receiving vaccines can also use BeSafe, which is an online system or web app where you can enter in any symptoms that you're having or reactions that you are having following the vaccine. Again, we'll work with our state and federal partners to provide additional guidance to you all as it's available.
Thank you, Katrina. We will now turn it over to the media for questions. It looks like our media participant today is Ashley McCallum from the Janesville Gazette. It looks like Ashley's our only participant again today. So Ashley, we'll go ahead and keep you unmuted so that you can continue to ask questions. So go ahead, Ashley.
Great. So related to the Johnson & Johnson vaccine, I was wondering if the health department has done any reaching out to the vaccine providers or some surveillance as to where Johnson & Johnson vaccine has gone locally, and if there's any insurance or way of knowing that those providers who have had Johnson & Johnson vaccine intended to be giving out, if there's any way of making sure that they have supply of other vaccines so that maybe already scheduled appointments could still be accommodated, or I guess if there's any kind of centralized monitoring of that, making sure folks aren't getting canceled on and then kind of out of luck.
Thank you for the question, Ashley. The vaccine providers across the state were notified by the state health department regarding the guidance to pause distribution of the Johnson & Johnson vaccine. So that information did go out to providers very quickly following the notification from CDC and FDA. We've also been communicating through our channels, especially through the media and with our press releases to get the information to providers as well. As far as vaccine availability locally, we don't know exactly which vaccines other providers have access to. We do know that the availability of the other vaccines is pretty good right now. And many providers that we have heard from across the state have switched to being able to providing other vaccines besides the Johnson & Johnson. We're not sure at this moment if any providers in Rock County were no longer able to distribute vaccine because of this pause. We are anticipating that they did have other vaccine available.
All right. And so I guess I'm just kind of wondering why the health department, I guess, isn't reaching out proactively to providers to make sure that there's not any issues with supply. It seems like maybe something that wouldn't be difficult to call out to to others to see what's going on and where Johnson & Johnson is. So can you talk a little bit about why that's, I guess, not going on? I guess, is it just not a concern about availability locally?
Well, right now we know that the large majority of our vaccine providers have been receiving Pfizer and Moderna. Very few of our providers have received the Johnson & Johnson vaccine in Rock County, and we have, in our role as the local health department, helped facilitate our vaccine providers gaining access to Johnson & Johnson vaccines. So we know that the supply of Johnson & Johnson in the community is limited. We rely on a health alert network system in that notification process to healthcare systems and vaccine providers. So part of that health alert system is that the state provides that guidance and we follow up if needed with our providers.
Gotcha. And similarly to the kind of the last couple questions, we know that folks in the Rock County Jail within the last week were vaccinated, and Johnson & Johnson was being used specifically for those. Given logistics, it kind of makes sense to do so. And is there anything the county's doing, whether it's the health department or the sheriff's office specifically, to monitor the jail population for these symptoms specifically, given that it's such a relatively large concentration of all of this going to one spot? And we know that sometimes our jail populations can suffer different pre-existing conditions or health conditions, given the kind of absence of some regular routine health care that many other folks do get to have in the community. So is there any, I guess, specific monitoring to make sure that those folks are doing well post Johnson and Johnson vaccine?
Absolutely. Thank you, Ashley, for thinking of that question. One of the first vaccine providers we heard from the morning that the pause on Johnson and Johnson vaccine was announced was the vaccine provider that did administer the vaccines in the jail. So we do know that a letter went out to all individuals who reside in the jail who received the vaccine, letting them know about the situation, letting them know about any symptoms to watch for. And that was really great, quick action from that vaccine provider. So there's been some coordination between the vaccine provider and the jail to make sure that all of the people residing in the jail are continuing to be healthy following the vaccine and not experiencing any of those adverse reactions.
Great. Well, those are all the questions I have. Thank you for giving me some time today.
Great. Thank you so much, Ashley, and thank you for participating today. We will conclude today's briefing, and I just want to thank everybody who's been watching this on our Facebook live stream. And again, thank you, Ashley, for participating. If anyone else from the media is interested in participating in these live media briefings with the ability to ask questions live, they can send an email to media.publichealth@co.rock.wi.us, and we will send you the information that you need to be able to participate. So thank you again, everybody. We will see you again next week, Thursday at 11 a.m. Be safe and be healthy.